Okay, well, good morning, everyone. I read this week that 80% of people were experiencing election anxiety, and now we've had the election, so that's all over, and our problem solved, right? No. Well, we know that's not the case. We know that mental health is a real crisis in this country, and I don't want to frame this discussion in terms of the mental health crisis, although we hear a lot about it. I really want to frame it in a different way around access to mental health care and what we as health system leaders can do to increase that access. More than half of Americans, and that's 60% of children, are not able to access mental health care when they need it. So it seems appropriate in this group of health system leaders to be thinking about our role in solving that problem. And you as leaders are reflected on the stage as these leaders that I have on the stage here who are all health system leaders. I'm Anna Bob. I am the executive director of a coalition called the Path Forward, which focuses on mental health policy and practice reforms that we achieve through laser-like focus across the entire healthcare ecosystem. So our coalition brings together organizations that represent everyone in the ecosystem, 38,000 psychiatrists, 3,400 treatment organizations. We have 650 patient advocacy groups through NAMI. We have employer groups who purchase benefits for 45 million Americans. We have chief human resource officers. And so Path Forward is one of those health system, cross-system approaches. And what we realized as we looked at our group here today, these distinguished panelists who I'm so pleased to introduce you to, is that these two represent our whole healthcare ecosystem. So in prepping for our panel, we decided we've got to put on our health system hats, and we have to tell you the hats that we're wearing. So I'd like to introduce our distinguished panelists to you. We have with us, we have Teresa, who is the Chief People Officer with the Santa Clara Health Plan. We have Chelsea, who is the Chief Growth Director for Northwell Direct. We have with us, I forgot to tell you, Teresa wears our employer hat, right? We put that one on, and we put on Chelsea, we gave her the provider hat, making key connections to employers. We have with us Liz Polson, and you can also read their names on the screen, who is our Senior Director for Intermountain Health. Given Intermountain's vaunted position in the healthcare field, we gave her our Integrated System Industry Thought Leader hat. And then we finally have Nicole, who is the VP of Wellbeing Engagement at Lockton. And as a broker, we gave her our Matchmaker hat. So we're putting on our hats to have this conversation with you. And I'd also like to say thank you, of course, to all of our supporters here and Behavioral Health Tech for having us, and of course to Solomon and her team and Danielle and our AV friends and everyone who's making this possible today. So as we were discussing this, and it was a very good conversation, we were trying to decide how we wanted to frame how we think of mental health. And we realized there are these definitions that stop many of us up. And mental health is, in many ways, we think of it as a clinical thing. It means you have something wrong with you. And we also have this other concept that we talked about, which is the concept of well-being. And well-being includes being mentally healthy, but it also comes from a human flourishing background, and it's a term that's much broader and includes things like hope and freedom from stressors and ability to function. And so we wanted to talk about this whole topic today, centering around that concept of well-being, that broader, more wellness and strengths-focused concept. I don't think I've done that justice, so I'm going to just ask my panelists here to just go through and sort of talk about that term of well-being and what that means to them personally.
Great. Well, as Chief People Officer for a health plan who has a vision that there will be health for all, I think that it's important to point our mission inward. If you imagine going to an Apple store, you would not expect the employees to have Androids. So we have to think about the health and strength and capability of our workforce. And that is one of the ways that I anchor the work that I do in employee well-being. And we'll talk more as we go through the questions.
Awesome. So as we think, Northwell Direct is the employer partnership arm of Northwell Health System, largest New York-based health system, many hospitals, providers. And so as we think about relating to our employer community and employee health and wellness and engagement, it's really holistically. Like, we have every service line under the sun. We don't want to view you as a single condition or disease state. We can really take care of the whole person, whole patient. And so to us, that's really the differentiation and value we're trying to bring into our employer and ultimately the end user, right, the employees and their dependents, is how are we able to take care of all of your needs so that you're able to get better across.
And for me, I work at Intermountain Healthcare, and Intermountain Healthcare is an integrated health system. We have a health plan, Select Health. We have over 63,000 caregivers in 33 hospitals in the Intermountain West. And so for us, our mission is helping people to live the healthiest lives possible. And so a way for us to serve that mission is really to focus on our own caregivers, the people that work with us, the people who are serving the people, and help them in their well-being. And we'll talk more about that. And well-being to me is really making sure that we're honoring everything that's a non-negotiable to us that helps us to live our best lives and to show up in the best way possible.
And at Locked-In, as a benefits consultant and our team, the Wellbeing and Engagement Practice, we help our clients with really designing strategies that are very holistic in nature, understanding that mental health is a component of well-being, but so is caregiving, so is their professional development and growth within the organization, financial wellness. All these areas we really touch upon in helping design that holistic benefits and well-being strategy.
So when we were thinking about this issue, we thought there were two key ways to think about employee wellness. One is what, as a purchasing power of an employer or as someone creating a benefit, how you can use that benefit to improve that employee's access to care and the quality of their mental health care through the traditional healthcare benefit. And the other way is this more emergent idea of workplace well-being. So we thought we would sort of start with this more traditional idea of the health benefit and the purchasing power of the employer, and we would sort of explore what strategies are working to improve employee wellness through that particular tactic.
Go first. Sure. Okay. So thinking specifically even with the area of mental health and when we're designing these well-being strategies, what we do with our employers is really look at what do they currently have in place today through their health plan, other benefits such as their EAP, and really understanding what gaps or opportunities exist within their overall strategy. And is there a new solution or a new need that needs to be addressed that can be addressed through leveraging their existing resources or finding the right potential point solution or technology to help engage employees in their mental health. Another piece of that, too, is working with the employer to really understand what is their communications strategy to raise awareness and education for the benefits that they have, because usually that is lacking because they have a lot of the tools and resources already there, but helping them design innovative communication strategies and tactics with their employees and management are ways that we help to drive access to affordable and quality care.
And so for us at Intermountain, we actually we're in a unique position where we own our EAP. So in some of our larger facilities, we actually have some of our EAP counselors that are there on site and available. We also are able to pull some of those counselors in to different situations that we have with leaders. In my role, I'm an HR really consultant with the leaders, and we've had some situations, even just with change management, of pulling some of the counselors in to the situation to just talk through well-being, where people are, help them to process, and that really helps to normalize that mental health piece. And then we've also seen some smaller employers organize. There was one example of about I think it was about 8,000 smaller employers that got together and used their negotiating power to be able to negotiate lower costs with us on our EAP program, and they actually got a cost that was 66% less than the normal price. So I think that's another strategy is smaller employers coming together to negotiate for EAP benefits.
Yep. And as a health system, we are still innovating around how we can better serve employers and bring care outside our own four walls. There's 3 different strategies that we have with Northwell and Northwell Direct. The first is we offer a self-insured employer benefit. So we are the 32,000 contracted network, forms tier 1 or a preferential tier of a 2-tiered benefit plan. We have over 5,000 behavioral health providers as part of that plan, so really emphasizing access and inclusion just directly through your health insurance that you get from your employer. The second strategy we have is around navigation. So even if your employer's chosen United, Aetna, Anthem, whatever, we realize that it's very hard to find an in-network behavioral health provider that has any remote modicum of access, right? You'd be like, oh yeah, finally someone who accepts my insurance. I'm on a 10-month waiting list. And so we have a navigation and access program in partnership with our behavioral health service line to, one, help just like let you speak to a clinician right away to understand what is it that you need so you can find the right care pathway versus have to bounce around to many different providers or doors before you find the right one. And then the second thing that we offer is a full-blown all the way through care delivery. So we can solve the problem of the employer of just, hey, I have a health plan, I just want to use my health plan, just help my people actually find care. Or we can go the full gamut of, no, we want something that's a whole product, right? We want to be able, from navigation through delivery, and we've partnered very closely with our behavioral health service line because I have all these wonderful clinicians already. I'm not reinventing the wheel. How do we get them to be able to connect differently with employers and ultimately, right, employees and their dependents? So that's the way we've at least piloted as we're looking at what can the health system do differently and how can we extend, out into the community to reach folks.
That's great. So it's really fun being on this panel because you're hearing different perspectives and different approaches to a common issue, which is access, availability, and quality. One of the things with respect to purchasing power that I don't have to worry about is, as a public health agency, we are a CalPERS employer, and we have the purchasing power through CalPERS to have our benefits selected for us. And so I have actually the joy of thinking about the supplemental benefits. What can I do, one, to firstly make sure that our employees are aware of what we offer across all health-related benefits, and then identify based on what's lacking, what can we do to supplement that, whether it's something with respect to creating opportunities for them to be connected through campaigns that attend to their physical health and their sense of community and social. We've done certain things to have a platform as part of our Healthy Workforce Initiative. It's a large undertaking that attends to that aspect of their well-being, but also reaching in with our brokers around our flexible spending. How are their dollars increasing their access availability, as well as standing up their financial capabilities to do things that they otherwise may not be able to do. Having educational classes to inform folks within our workforce on how they can make those elections. And then when we think about distributed teams, I mean, if we raise our hands for workplace flexibility, we have people distributed across our state, our nation, and so having programs that work for the whole, and then creating ways through our supplemental benefits for people to come together and have that well-being with that community and social lens. So we are absolutely taking advantage of digital. We're taking advantage of what we can do in the office with respect to having health and wellness fairs. We bring our partners on site. We do health screenings. We've had some people realize that I need to go get seen. I might have some skin cancer happening. We have other pre-diabetes screening that we do, as well as just matching them with that person-to-person care and then continuing that engagement over the digital platforms. So I know that was like a large and long answer. I'm happy to go a little bit deeper, but I think that it's not a easy one solution type of approach, but we're trying to do many things to holistically ensure our employees have access to health and well-being.
Yeah, super helpful. Well, and so go a little deeper, because you really touched on the well-being aspect. So thinking in that broader well-being frame, talk a little more about how you think about it, and we'll ask our other panelists also to riff a little bit on workplace well-being.
Okay. Well, when you introduced us, you said the word strength. And so for those of you who are familiar with Gallup and Clifton Strengths, they are doing a lot of study with workplace well-being, and I've identified 5 drivers of well-being. And so purpose is a big one. So being an employer, hopefully people are pointing their purpose to a vocation within the health system. But there's also physical, and then there's social, community, and financial. So we're trying to look at ways that our Work First initiative attends to all of those drivers, and that the level of commitment from our employer perspective is strong and compelling to engage our employees.
Yeah, I think that's spot on. I would just add, we are definitely in learning mode. So as the provider system, we're trying to better understand exactly how employers are defining employee well-being and how we can fit into that puzzle. And it seems to be evolving quite quickly as well, especially kind of coming out of pandemic and into the today of what does it really mean and how is it, and this is honestly where technology is very helpful, like how is it customizable? Like we can't just create one cookie cutter solution of like, okay, fine, this serves everybody the same way, especially if the definition of wellness and well-being isn't the same across each employer you speak to. And so I think it's definitely a journey we are all on of how do we take the pieces of the ecosystem and fit them together and integrate them more fully so that we are truly taking care of the whole person.
I just want to comment before we go to the next friend we have here. The pandemic was something that we had lots of learning and takeaways. And thinking about technology, we all participated in the global pilot of working remote and found that we don't have all the systems that we need. And systems with an infrastructure as well and capabilities of the workforce. So in 2022, I was very passionate to evaluate HR and the capabilities to ensure that we are skilled to serve the organization. And that means creating a compassionate workforce. And that really ties into well-being at work and kind of what you said about systems.
Yeah, and I appreciate that. And I think one of the things that we do within our well-being program, and we're very fortunate that we have a director of social well-being, Emily Sterling, who helps with this throughout our system. And we have a peer support program and peer support training, which I think really helps with what you mentioned about compassion. Part of it is just regular peer support of having an expectation and tools to be able to just check in on your coworkers on a regular basis. And then we also have a peer support program that connects people with similar lived experiences that can really help as well. And again, training for that. And then leaders as well, having those types of resources and expectation for them to be checking in with their caregivers on a regular basis and having that compassion and really showing that throughout the workforce.
That's great. Yeah, I really like that we're bringing up the social component of well-being. So when we work with our clients, we really think along 4 pillars of self, financial, community, and career. Community really emphasizes that social component, whether it's through the development and engagement with ERGs, or it's peer support, or champions or allies networks. Like that is a critical component of the overall culture that the workplace is trying to create. Another element that we are also finding with several of our clients is really looking to address social determinants of health within their overall well-being strategy, and recognizing that things such as health literacy, financial literacy, food insecurity, transportation, housing, all those social risks are impacting their ability to actually access the care and the benefits that you have available within your organization. And so really taking a deeper dive with our clients about what are those key social risks and how can the employer really support some of those elements of that bigger well-being strategy that they have in their workplace. And so just want to make sure we call that to attention too, because I think you're all being impacted by that as well in a different way, but from the employer perspective, that's helping at driving engagement if you're addressing those social risks.
Yeah, and I just want to touch on that too, because we've just started to pilot a survey on social determinants within our caregiver population, and part of what we're seeing too, we're able to take that data and look at trends by the different types of roles that we have in the different populations, and then try to develop strategies to be able to address that as well.
Wow, I love how that question just opened this up so much bigger and made such a bigger frame. And it's really interesting to me that the word compassion, that in some way one of you touched on it, that word keeps coming up. So, we wanted to honor the spirit of this conference, which is technology. So in that spirit, I'd love to ask our thought leaders, what are you seeing and what's missing?
Well, one thing I'm going to say is I'm going to give a big shout out to technology for being able to gamify well-being. Right now, we're kind of wrapping up Walktober. Who knows what Walktober is? Okay, a couple people. So you got to Google it and find out more. Part of the workforce well-being initiative, having a driver of physical, we have a campaign that we run called Walktober. And since we've launched our Healthy Workforce Initiative, around that key driver for physical, our workforce has locked in just 1 year, 110 million steps. That isn't just about the physical aspect, but also the community, because you're doing it with building teams, and we're gamifying it by recognizing people who meet their physical fitness goal attainment, doing drawings, making it fun. And so when we think about just that standpoint of, could we have done that without technology? Absolutely not. There's a wellness wall. People post pictures of their family, pictures of their dog. This is where I went for a walk. It really kind of creates that level of engagement and interest where people get a little fear of missing out, and they hop on the following year, or they take advantage of other things on the app that they wouldn't have otherwise seen if they weren't drawn to kind of look at the stats and check it out. So that's one way with technology. And we'll be adding technology to our EAP platform. Our provider's actually here, BHS, and they just launched Revive, which is a human-led, technology-equipped effort that's going to really kind of change the game for us, and I cannot wait. So technology definitely has a role to play with the engagement piece.
Okay. Yeah, I got a real talk with you right now. There are so many great things that technology can unlock, and there's so many options and platforms out there. We, Northwell, do not want to recreate the wheel on that. We have not figured out how to deeply partner, right? We are complementary in what we're able to do. I'm able to serve in my geography any possible service someone needs, and I don't want to create a national disease-specific solution. I don't have the venture capital to do that. If anyone wants to give me a $10 million check, I'll change my mind. But it exists out there. We haven't figured out how to merge our capabilities with these point solution tech capabilities in a way that truly generates something new and novel for the employer purchaser. And so if anyone in this audience has a great solution for that, we are exploring, we are trying really, really hard to find what is the way that we don't just each build within our own silos. Haven't unlocked that yet. And I know technology is doing so much, and it's so cool with all of the new, I've tried Wobot, you've done all these little things. It's great, it's fantastic. We have not integrated it with the rest of the care delivery system in a way where I know I'm bringing something new and valuable and different with that partner versus just, we're kind of side by side in our product set. So if anybody has solutions. We're not going to solve it on this panel, but something to think about.
And I think what's going well with technology, I would say one thing is the ability to have virtual appointments, because people can be seen where they are. That's often less expensive. We have one service that we just introduced within our Select Health plan, and right now we're piloting with our caregivers, where we have an APP that's available for counseling and then also for medication management for our caregivers, and they're able to get in much more quickly to that provider, and that's really helped. So I think that's positive. I think the ability to put our well-being platform and our well-being resources out there to our own caregivers on our intranet side. Use QR codes, to scan and get to those resources quickly. I think that really helps. I feel like a technology gap still, though, that we have, because we have a lot of remote caregivers, is the ability to help them really feel connected, even though they're working virtually. So I think even with the technology that we have, that continues to be a challenge.
That's a great answer. I feel like we've heard that in multiple sessions over the last 2 days, where it's like still technology's been great to be able to create that accessible point for everybody to get engaged within mental health care or any other parts of the well-being system that an employer's put in place. But the human connection is still needed to some degree, and how do you recreate that in a technology environment? From an employer perspective, and what we're seeing too is like, how do all of these apps or solutions integrate with one another? And a lot of employers are being challenged by, there's just too many things to send their employees to. And so there has been greater interest in how do we consolidate or begin to integrate these technology applications better. And so thinking about solutions more holistically, I know that there's many wellness platforms or even mental health where you're broadening the solutions and the services that you have in there to be a one size, can fit everybody to whatever needs they have is, I think, important, so they're not driving their employees to 10 different apps for whatever their care needs are. And so I'm thinking about how do you simplify the technology from the delivery end for the user is going to be important.
Have any of these platforms, have you, any of our panelists considered, or through your organization, deeply considered, purchasing one of these platforms or engaging it as part of your offering? These platform solutions.
But yeah, as locked in as an employer, we do have several different solutions really tailored to our benefits and well-being. I can't even name all of them right now, but I'm not going to. But yeah, we have several. But and they're available on your app. I'm sure you all have some too at each of your organizations.
Yeah, we do as well. I mean, we have some that we've developed, and then for our caregivers, for example, who are in areas where we haven't introduced Select Health yet, which is our own health plan, we contract with Cigna, and Cigna contracts with some of the other providers of mental health, like Meru, and I think Talkspace is another one. So we do utilize them, but I agree, we're still working on really making sure that's completely integrated and accessible.
Yep. So we've taken a very kind of multi-channel approach. We're an investor in some of these through Northwell Holdings. We've built our own platform through pandemic to do care for caregivers, and are now looking at how do we externalize that. We have peer support resources that we have across our clinical teams. So there's a lot of different, whether homegrown or in partnership or as an investment arm, we've engaged with these point solutions.
In terms of some of what we're touching on with visibility, we have among all of our employers like a workplace intranet. So within our intranet, we have a well-being page. We have a monthly communication with a theme that talks about ways to observe that theme. For example, this month is about gratitude. What we also do to have that human connection is to support it with a lunchtime learning. So there's a commitment from the employer that every third Friday there's going to be a topic around well-being and health. And this month it's going to be the science of happiness. And as we go ahead and spend that time together during work time, it's 30-minute power half hour where we remind them to go to the resources. We've got quick links and different points of engagement where, while we might have different access points, it's available in one landing page for them to go and to learn what's happening this month, what's happening next month, and how is this going to be connected to those 5 drivers of well-being. And that's really, really important. It also reaches out to the community. When we think about one of the drivers for well-being being community, having that sense of service from yourself to your community that you are in. And those are ways that we have that engagement. And about 87% of our workforce has flexible schedule. So it really, really matters to have a standing location that you can go to get this vital information about how to be well and do well together.
So, okay, thank you. Well, That's great. So power hour, did you call it? Or half hour of power?
Power half hour.
Power
And
half hour. Okay,
yeah.
so I hope we've given you something of a something of that just now, power half hour. We would like to turn this whole discussion, we'd love to open it up to everyone, to all y'all. And we have mics at the center. We are old school and ask you to just, if you have a comment or question or an engagement, to just come to the mic and bring your questions that way.
So thank you. I appreciate it. So this is my life work. So I spent 30 years in this well-being programs. And so I think it's interesting to sort of hear the edginess, right? So I'm going to ask a hard question. Given the election results and given the fact that we know, and we've been through this, where we see the conversation changing, can you address, like, how are employers going to be coached to include programs that we know are important, but they may decide to hit some delete buttons on? I practice saying that diplomatically. Did that work?
You did a wonderful job.
Because my heart is like,
Yeah, from our practice's perspective, when we talk about well-being with any of our clients, we're really considering that holistic perspective and we think about community, we're thinking about relationships, we're thinking about DEI, we're talking about charitable giving, being a part of the community, really thinking about those elements, but then also with like I've brought up social determinants of health and health equity, like that is a key component of a lot of our conversations we have with clients, and looking at the disparities or the inequities that exist, and there are strategies and solutions to address those needs, and so working with them to really enhance the overall employee experience is what we're committed to doing, and we will continue to do.
And I'll address that too, because I think that I appreciate you asking that question, and the results of the election don't change our mission as a company, and so, yeah, the results of the election do not change the mission, yeah. So we are still focused on helping people to live the healthiest lives possible. We still will prioritize well-being overall, including mental well-being, and I think what's really important, I was thinking about this morning, is I think we all just have to start, just take actions that we feel like are important, that continue to do, our important work. And I think especially, I'm thinking about this as an HR professional, really working with our leaders on making sure that they are checking in with caregivers even more aggressively, just given that we have some people that probably are in a difficult place right now.
Yeah, look.
I'm Lisa Bertola. Oh, I'm sorry. Lisa Bertola, consultant from Siegel, and I'm just curious about the peer support and how you curated peer support, trained those groups internally, especially for caregivers. I think this is wonderful. And also opening up a question for all panelists, HIPAA and, siloing some well-being solutions, transferring that information and data on engagement into the health plan or other reporting systems. Do you find ways around, tracking and kind of consolidating the overall picture of how employees are engaging with well-being, both, accepted benefits or health plan benefits, looking at the whole picture so you get like kind of a good blueprint? I'd be interested in your thoughts.
So on the peer support side, I'll just address it briefly, and then if you want to connect, I'd be happy to connect you with our Director of Social Wellbeing, because she really is the one who's focused on this. But what we've done is we have actually just like, it's a simple Microsoft Forms survey, but we've had one of our IT people really work on helping to match people. And so when people want to be matched with a peer support person, they can fill this out, they're matched. And then we have the training that was developed that they can also request that training. So all of that is available on our intranet site. So it's very accessible. And then it's something that we talk about in town halls, we talk about in other meetings. So we have a whole overall communication campaign on that. And then I think your other question was on reporting, and yeah, and so I'll just briefly address, for us, we do have a well-being component of our employee engagement survey, and so I do feel like that helps us to keep that front and center, and leaders get those results, and then we in HR can partner with them on specific action plans to address that and measure it.
And I, if you don't mind, wanted to comment on the previous question. I think that even with the result being a disappointment, one side or the other, I am fiercely optimistic because I believe that love always wins. And so what happens now with these organizations who've had a DEI initiative, we will find out if it is a part of who they are. This is going to be an opportunity for a deep reevaluation, and I've always championed DEI as a life. It's not for a moment. It's a lifestyle habit. And I'm not discouraged, and I hope that we can hold each other up with that encouragement that we see each other and that love is going to lead us to recognize the power of each individual's valuable life. So.
It's so interesting, too, in these so-called corporate events. There's often this kind of thread of the quiet crusader, the person who's quietly and with their program just, bringing forward programs year after year after year. And I think that's how change is often made. It's not always these big things. It's small things that add up. We would love to engage more. Are there other folks who have things they want to share?
So I love that question because when I talked about being people-centered, I had so many naysayers say that you cannot win in the market. But it's your employees that make up the business, and this topic is about engagement. It's no different than healthcare, where you can come for a diagnosis, but when you go home, you have to tend to your well-being. So when we look at our differentiating proposition as an employer about being a great place to work because we care about you, then I hope that you are more impassioned to care for our members and to care for the community at large. And so we have to do a good job about being authentic and being committed and being intentional.
Liz, do you have something else?
Yeah, I was just I completely agree with what you just said, because it really is about, it's about creating a culture of well-being that's taking care of ourselves, taking care of one another, so that we can also take care of the patients and do that job. So it really is finding that balance. And I completely agree, being authentic and weaving it into everything that we do.
And I think it also goes into role modeling in leadership, and how are they demonstrating their own well-being and taking care of themselves, where that's going to also trickle down through the team and to the frontline employees. And so taking, if this is a true value of the organization, it's happening at the senior leadership level, and then you're feeling it, and it's part of the culture, and that's what we're kind of all touched upon.
Lady in red, did you have a question?
go ahead and go first. So I think when we work with our employers in designing a strategy around workplace well-being, we're also wanting to understand what is their overall benefits philosophy. Are they really looking for the true return on investment and health savings costs on any of their health plans, or are they looking to really have what we call VOI, value on investment, and as part of the overall employee experience, and really addressing attraction, retention, other elements of the employee's overall experience in the organization. And so some of the things that we think about when we're setting up a program and really helping them design is part of it is looking at overall claims costs, seeing what some of those health, the gaps or opportunities are, addressing some health concerns, but then also looking at employee survey data, whether it's an engagement survey or listening tours with employers, and understanding what do employees actually want, what's going to be relevant to them to help engage them in the solutions that you decide to put in place. And so things that we'll measure over time is obviously engagement, utilization, potentially cost savings if that's the driver they're looking at, but also looking at overall turnover and retention within the organization, or some of those other long-term measurements that we're looking at with our clients.
And I'll just touch on that too with that. So we use engagement survey data. With some of our other programs, we honestly are still really working through the best way to determine which are the most useful and not. We've tracked them in different systems, and we're working on tracking that and tracking utilization in one system. And then also, just through rounding that our leaders do as well, we also have some anecdotal feedback on what works and what's not working.
Yeah, so Northwell Employee Health Plan is 85,000 members, and our CFO holds us to line item by line item what our savings and how we're reaching the savings target each year. And even worse, by the way, if someone goes to our own ED, they do that at cost. I don't save the $10,000 ED visit. They're like, you saved us $500 because, right, we're paying our own providers. So one, cost measurement of what are your interventions and what is the impact in terms of cost savings as a self-insured health plan, very critical. That manifests in the claims data. It's a combination of price and utilization. So are they going to the right and lowest cost place for what that's able to serve their needs? And are they doing the right set of things? You don't need 15 MRIs, you need one. And so there's that component. And then the second piece, I think, is what you mentioned around utilization and also length of engagement. So if we put a solution in place, how many people are actually engaged in using it, and for how long? Because if they start the care journey, we have a homegrown behavioral health solution for our own employees, and we look at, are people actually completing the recommended clinical regimen? Because that's cute if you got 10% of the population to start it, but if nobody actually finished what the clinician had recommended as the set of services required to get better, well, you didn't really accomplish something long run. And so I think the kind of close the loop is very, very important as well. Just not the ooh, shiny object, but did it make the actual impact over time because people kept with it?
And I'll touch on a little bit of that. I think what's important is to understand foundationally that getting started, the initial work is to define what well-being is for you and to make it part of your conversation. So one of the ways that we've measured how effective we've been at doing that is our utilization for our EAP services, especially our therapeutic services, has increased. And it has not only increased, but people are more comfortable to be specific. We can see what are the cases that are coming through, and we've also increased our number of available visits so that we can truly say that we provide free mental health services. And then we want to be able to tie back that data to our turnover rate and reasons why people are departing, as well as looking at our leaves, FMLA. There's lots of increased utilization for workplace burnout, stress. People are using FMLA for stress management. Now, FMLA is for, taking care of yourself when you need to be away from work. But if we can look at that for something that's really not related to something we do better at, we want to have that data to make those type of decisions. And so, and we're getting a lot of ADA accommodations for anxiety and depression. So we have a lot of data that if we just kind of curate some type of a formula to address part by part, we can tackle that and point people in the direction of services that we provide. Thank you.
What a great question. So relevant. So I guess we have just a couple more questions. I think we're kind of almost at time. Is it a very, very quick question? Or okay, do you want to just?
So from an employer standpoint, have any of you seen struggles between where the line is between where they're an employee and they almost become a client based on, like you said, you do your own EHP programs and through there, like, do you struggle with where that line would fall in that?
So who wants to take that? I think we have one person can answer. So.
So I think we do sometimes have that, and I think that the line, at least in my experience, needs to be that if the person is a client in that situation, it's the EAP counselor who's handling it. The leader needs to have a clear handoff, care about the caregiver, but not get involved in really being the provider at that point, handing them off to somebody clearly in the EAP who is the provider. But it's a great question because there's a really fine line there, and it could be difficult.
Thank you for that amazing question. Sorry, we couldn't do more justice. Our panelists will be here to talk to, and thank you so much for your time, just leaving you with the wonderful words of well-being and compassion and yay technology. So, yay.